The bad news, the cancer is on the rise, but the bad news is in some countries, cancer does not mean death, but in other countries, cancer does mean death. And we see that 70% of deaths are in developing countries, our countries. And this is what we're all working towards, to stop and reduce mortality in cancer care all over the world, especially in developing countries. Access to quality care, I always say, you know, when we go to these conferences, and they put it very all you have to do is walk into a hospital. But actually, access to quality care is really like an obstacle course in the Olympics. You have to surmount cultural barriers and stigma. You have to be lucky. You have to have the information about cancer to figure out that you have to see a doctor. If you surmount that, you're lucky to first find a treatment center or a department. Then you have to surmount if you find a quality care cancer place. Then if you have that, do you have the money to pay for it? And if your disease is fatal, do you have palliative care? And the list continues and continues. Access to quality care is many things. It's for us in the developing world, it's still the case. And we see that here in Ghana. And as a result, many people, if I want to explain why so many people are dying, we look at this. We have our countries, lack of regulations. We're not stopping the new customers of cancer. Junk food is on the rise. Smoking. I'm glad to know that apparently smoking is not a problem here in Ghana. Brilliant. Keep it that way. Make sure Philip Morris and the rest don't come in, because they're trying to find new markets, by the way. They have inhabited the lungs of our youth. In Jordan, 70% of men smoke. 25% of our youth between 13 to 15 smoke. They are looking for new markets. Be aware. They are dangling their dollar money and their tax bill for the governments. Make sure they keep away from Ghana, because that's another thing. So obesity on the rise, alcohol, and so on. So we need to also take care of the prevention side, to turn off the tap